Good morning and welcome to the Department of Medicine Grand Rounds. The CME code for today is 25164. It's my pleasure to introduce our speaker for today's Grand Rounds, Dr. Khatana. Dr. Khatana is an assistant professor of medicine in the Division of Cardiovascular Medicine at the University of Pennsylvania and a physician at the Philadelphia VA Medical Center. He completed his medical degree at the University of Pittsburgh, his MPH at Harvard, and his cardiology fellowship at Penn. Dr. Khatana's nationally recognized research sits at the intersection of cardiovascular disease, health policy, and social determinants of health, with influential work on Medicaid expansion, food insecurity, housing, and climate change. He's received numerous awards, including the American Society for Clinical Investigations Young Physician Scientist Award, and is currently principal investigator on multiple NIH and VA funded studies. Please join me in welcoming Dr. Khatana.
Great. Thank you so much. I really appreciate the opportunity to be here and to talk about some of our work and the work going on in this field. So I'm going to go ahead and share my slides and we'll get started. Okay, so as Dr. Cohen said, today I'll be talking about the healthcare impact of climate change through a health equity lens. So before I get started, I have to say when I got this invitation, maybe a little bit a year ago, obviously the social, political, maybe cultural climate was quite different. And just today, I was looking at a poll from The Economist, which asked Americans what is the most important issue facing the US today. And I was looking to see where people ranked climate change. And actually, it wasn't even in the top 5 or 6 categories, so they didn't even make a figure for it. And only about 5 or 6% of Americans really placed priority on climate change. Now, this is a change from a couple of years ago when climate change was much higher up in those rankings. So obviously, the public's perception of this has changed in some ways. Maybe when other pressing issues are coming to the fore, people think more about economic issues. But at the same time, climate change continues to be an issue and will perhaps be the single most important issue facing our society in the coming decades. So starting with this slide here, this figure here shows CO2 emissions from the industrial period in the 18th century onwards. And in the gray line here, we can see that CO2 emissions started increasing near the end of the 19th century. And as a consequence, the CO2 concentration in the atmosphere, which is this blue line here, has been increasing markedly starting in the 20th century. Now, there are other non-CO2 greenhouse gas emissions as well. This pie chart here shows that amongst the non-CO2 emissions, which make up about 25% of total greenhouse gas emissions, methane is the largest source, followed by nitrogen oxides, and the agricultural sector, followed by energy, are the biggest sectors contributing towards these non-CO2 emissions. But we'll largely focus on CO2 when we're thinking about climate change and the greenhouse gas effect. So for a problem like climate change, obviously it's impacting virtually every aspect of society. And so it's not a surprise that then it's also having an impact on health outcomes at an individual or a population level in multiple different ways. And going over all of those today is obviously beyond the scope of this talk, but I will highlight during this presentation some individual climate issues as well as their impacts on health. And so this includes things like extreme heat, severe weather, as well as changes in vector-borne illness, impacts to the food supply, etc. The other thing I want to highlight is just like almost any other public health issue, whether it's COVID-19, whether it's non-communicable diseases, the impact of climate change impacts certain populations, certain individuals disproportionately. And whether that's because of their current lived experience, their prior history, other factors, all of these lead to this disproportionate impact. So what has been the consequence of this increase in CO2 concentrations in the atmosphere? So the concentrations we can see in this black line here, which has been steadily increasing, as I mentioned, since the end of the 19th century. And because of this, global mean surface temperatures have also increased. And so these bars here represent deviations in the annual mean global surface temperature from the mean temperature of the 20th century. And so we see that in the initial part of the 20th century, temperatures were generally lower. We do see a few blips here and there, but then the later part of the 20th century and the beginning of the 21st century, we see this continuous increase in global mean surface temperatures. And then as a follow-up to that, what that has led to has been an increase in extreme heat events. And so I'll mention this term extreme heat a few times. It's somewhat of a nebulous term, but the way I would think about it is the occurrence of heat that's much higher than typical for an area. And then there's different ways of defining heat waves, et cetera. But regardless of how you define it, most estimates show that heat wave frequency, duration, intensity all have gone up since the 1960s. This is for the US specifically. So one of the things that we can see here is how this varies across the US. And so this figure here shows extreme heat days, which is defined here as the number of days above 95 degrees Fahrenheit in Philadelphia and Houston between the 1970s and 2019. And so we see an increase in both cities with a greater increase in Houston, where there's 34 more days of extreme heat compared to Philadelphia, where there's 5 more days on average per year. But when we look at the number of warm nights, which here is defined as night temperatures above 65 degrees Fahrenheit, we see similar increases in both cities. And the point of this slide is to show that even with heat, we have to take a somewhat more nuanced view. It's impacting our weather and climate in multiple different ways. And how this impacts health is also starting to become better understood, I should say. And so there are some studies suggesting that hotter nights may be even more detrimental towards our health than warmer days. And I'll talk a little bit about sleep and mental health a little bit later in this presentation that highlights that. So thinking about how extreme heat impacts the human body, we first have to talk a little bit about how heat is regulated in the body. So most of you remember this from medical school, but the human body can really operate in a fairly narrow optimal temperature window around 98 degrees Fahrenheit. And this is regulated by the hypothalamus, obviously. And so when there's an increase in core body temperature is detected, the hypothalamus through the autonomic nervous system leads to an increase in peripheral vasodilation and an increase in sweating. And there's other physiological changes in the body as well, which I'll mention just in 1 second. And so the human body has multiple mechanisms of dissipating the heat once the hypothalamus gets activated, but the primary mechanism is through evaporation or sweating. And so when liquid sweat turns into vapor, it absorbs heat from the skin and transfers that away from the body. Now, you do need a humidity gradient. So once the relative humidity is greater than about 75%, then sweating isn't really possible, and which is why in more hot and more humid environments, heat can be even more of an issue. And some of the other mechanisms, such as radiation, convection, conduction, are somewhat less important. Now, the reason I've become interested in this is because the cardiovascular system plays a key role in this whole thermoregulation system. To get heat from the core of the body to the periphery so that sweat can then transfer that away, the cardiovascular system through blood transfers that heat. And so I'll show that a little bit here. And so in response to an increase in the core body temperature, the heart rate will go up, the systemic vascular resistance will go down, and there's an increase in cardiac output. Like I mentioned, there's a peripheral vasodilation. And so this increase in cardiac output leads to an increase in myocardial oxygen demand. And so for people who are younger, healthier, this usually doesn't lead to any substantial issues. But in older people with or people with pre-existing cardiovascular conditions, people with lower cardiac reserve, this increase in oxygen demand can lead to a supply-demand mismatch and potential ischemia or infarction. Now, there are other mechanisms as well that have been posited, such as an increase in inflammation, hemoconcentration that can lead to an increased risk of thrombosis, so heart attack and stroke, that likely also play a role. This figure here is from a review article from The Lancet in 2020 by Christy Abbey, who's a world-renowned expert on climate change and its health impacts. And so this shows the different organ systems that are impacted by extreme heat exposure. And so besides cardiovascular dysfunction that I just mentioned, the respiratory system is also involved. Heat exposure can lead to bronchospasm and respiratory distress. And dehydration can obviously lead to electrolyte imbalances and renal injury. Certain people, because of pre-existing medical conditions or what sorts of medications they're taking, might be at an elevated risk. So the example that's most often cited is diabetes, perhaps due to an impairment in the nervous system that can impact how the body responds to heat. Certain medications like beta blockers, for example, can also impair the response to heat. And then if people are on diuretics, that can obviously increase the risk of dehydration and kidney injury. So this was a very interesting study that was published in the Annals of Internal Medicine last year, where they took 3 groups of volunteers. The group that's represented in the white are healthy young adults. The gray bars or the gray squares here are the healthy older adults. And then this light blue are older adults with known pre-existing coronary artery disease. And so then these individuals had their core body temperature increased slowly, and they were carefully monitored. And then the myocardial oxygen demand, myocardial blood flow was then estimated using PET-CT. And so here we see what happens to myocardial blood flow in these 3 groups as core body temperature increases. We see that for all 3 groups, there's an increase in myocardial blood flow. But then when we look at the change in the myocardial blood flow, it's much slower amongst older people and then even slower amongst people with pre-existing coronary artery disease. And so then the authors provided the PET-CT images of certain individuals who kind of stood out. And so for those of you who aren't familiar with this, what we're looking for are darker parts of the circle. So this kind of slices the heart like a bread loaf, and darker areas are areas that aren't getting enough blood flow. And so we see at baseline, there's this area in the inferior part of the heart that probably isn't getting enough blood flow, but as core body temperature increases, this area starts getting darker and darker. And then at the highest level at 1.5 degrees centigrade, we see that it's quite dark. So this individual who had some pre-existing supply-demand issues got this, we can see, got much worse as core body temperature increased. So another important health consequence of heat exposure is obviously heat stroke. So this is one of the most serious consequences, I would say, and has a very high mortality rate, approaching about 70% if care isn't provided. And the definition varies depending on which source you look at, but generally it's defined as a core body temperature greater than about 104 to 105 degrees Fahrenheit with associated CNS dysfunction. And as you all probably know, there's 2 types of heat stroke. The non-exertional or classic heat stroke is what we think of in older or more impaired individuals with chronic medical conditions. This typically happens for people who are maybe isolated and aren't able to get themselves out of a hot environment. And then exertional heat stroke typically occurs in younger people who are engaged in heavy exercise. So we can think of people who are like runners outside, et cetera. And there's a number of physiological responses to heat stroke. People will present with tachycardia, tachypnea, hypotension. There might be EKG changes, but eventually this can lead to seizures, DIC shock, and eventually death. Treatment is supportive care and cooling. So thinking about heat and mortality, one thing that we were interested in was trying to understand how many people in the United States die from extreme heat exposure. Now, maybe that sounds like a relatively simple question, but I'll show you why that can be quite complicated. So this is a figure that shows daily deaths in Chicago around the time of a heat wave that occurred in 1995. And so we can see In this orange line here, the average daily deaths for the decade of 1990 to 2000. And then we can see daily deaths in the period around the heat wave, and we can see this big spike. And it was estimated that there was about 700 additional deaths in Chicago during the time around this heat wave. Interestingly, when you look at the death paperwork for these people, only about 465 had heat-related issues as being mentioned in the death certificate. So a decent number of people did not have heat mentioned as either a primary cause or a contributory cause on their death paperwork. And so the reason why that's important is, I'll show this slide first, is when the CDC has tried to estimate how many people have died due to extreme heat in the United States, this particular analysis that they released in 2020 looked at deaths between 2004 and 2018, and they estimated about 10,500 people had died due to extreme heat, which translates to about 700 deaths per year. And so this relies only on death certificate data. And so we were interested in seeing whether A, that was accurate, and B, what type of subgroups were being impacted by this more than others. And so to answer these questions, we had two papers that ended up being published in JAMA Network Open and Circulation. This was in 2023, I believe. Looking at the association of extreme heat with all-cause mortality and then cardiovascular mortality between 2008 and 2017 in the continental United States. So this figure here shows the number of extreme heat days per month, it's the annual number of extreme heat days by county across the United States. And the counties that are this darkest shade of red had the highest number of extreme heat days. And so we see that's obviously here in the South, parts of the Midwest, and the tip of Florida there. But what we see is that virtually every part of the United States in this period of 2008 to 2017 was experiencing extreme heat days. That includes the Mid-Atlantic, where we are, and the only places that we didn't see this were a few counties in the Rockies. So next, this is the number of the average monthly rate of all-cause mortality and cardiovascular mortality at the county level. And once again, the darker shades are the counties that had the highest mortality rates. And we see that this corresponds roughly to a lot of the same areas that are experiencing extreme heat. However, we do know that that there are a lot of differences between areas that experience extreme heat compared to areas that don't. And so obviously any sort of analysis needs to account for these differences, and which we did using some statistical methods in a modeling approach called fixed effects. And so here's the result of that model. So after adjusting for some of the differences between counties as well as secular trends, we estimated that for every additional extreme heat day per month, the number of deaths per 10 million individuals increased by 7.4 for all-cause mortality, and a little bit under half of that, 3.1 for cardiovascular mortality. We also looked at some subgroups as well, and we see that there's obviously a greater increase amongst elderly adults, so 22 additional deaths. This is per 10 million individuals, I should say, amongst older adults, and versus only 3.7 in non-elderly adults. And then I'll talk about some of these differences in just a little bit. And so then here is our estimate for how many total number of deaths were associated with extreme heat. And so depending on which definition of extreme heat we used, we estimated that between 2008 and 2017, there were about 13 to 20,000 additional deaths from any causes, and about 6,000 to 7,000 additional deaths from cardiovascular mortality. So this is substantially higher than the rate that the CDC was citing. And I think this shows that relying on death paperwork data is inadequate if we really want to understand the actual burden of extreme heat, or honestly, really any exposure-related death. And so this is a figure showing annual extreme heat associated deaths from any cause by year, and we see this big spike around 2010, 2011, when we had a particularly warm summer here in the United States, followed by decline, and so this sort of changes from year to year. So going back to our subgroup analysis, so this is for cardiovascular mortality specifically, and here we wanted to see how many additional deaths occurred amongst one group compared to another. And here we saw for elderly adults, there was a significantly greater increase in cardiovascular deaths. For men, there was a greater increase compared to women. And then we also saw that for non-Hispanic Black adults, there was a significantly greater increase in cardiovascular mortality compared to non-Hispanic white adults. And so we're starting to see that even with something that we would imagine is universal, heat exposure, the impacts are uneven. And so a few studies have tried to estimate the number of heat-associated deaths globally. And so this is from the Global Burden of Disease Program. They had a paper that was published in the Lancet in 2019, and they keep updating their estimates from year to year. And this is from their 2021 estimates. And here they try to see how many deaths or excess deaths are associated with non-optimally hot temperatures. So non-optimally hot is a little different than extreme heat. Here, the authors try to define a temperature which they consider to be optimal, and then any day above that temperature would be considered non-optimally hot. And so that also includes milder and moderate degrees of heat. And so we see that the countries shaded in red and orange, which are in the Middle East and parts of the Sahara, have the greatest increase or the greatest number of excess deaths. But then when we look at the change in the annual number of deaths associated with heat, we see that some of the greatest increases have been in more northern areas like Scandinavia and parts of Central Europe. And so we know that certain parts of the globe are warming up more than others, and then obviously also differences in age structure as well as health systems also impact this. And so the next sort of follow-up thing we were interested in was, okay, we can estimate how many deaths perhaps have occurred in the United States due to extreme heat, but what does the future hold? We know that the climate is continuing to warm and that the number of extreme heat days is continuing to go up. And so we had two follow-up papers that were also published in JAMA Network Open and Circulation that were published in the last year or so, looking at the projected change in the burden of deaths associated with extreme heat. And for all-cause deaths, this JAMA Network Open paper, we also looked at deaths for both extreme heat as well as extreme cold. So thinking about how we project what the climate will look like in the future, obviously we don't really know, but we can make some estimates based on what trajectory the world would follow. So we've seen over the past few months or so, there's been a big change in the global economic environment, changes in trade relationships, et cetera, and that will obviously have a profound impact on the economy and maybe downstream impacts on health, the population, et cetera. And so climate modelers think about these types of different economic and social and environmental scenarios, and they've created this system known as the shared socioeconomic pathways, or SSPs, as a framework of thinking about the future climate, as well as some of the downstream impacts of that. And so we can see, depending on which trajectory the world follows, this is CO2 emissions here, global mean temperatures are projected to vary. Then also we can look at changes in global population as well that could vary depending on which trajectory the world follows. So we looked at two such scenarios that are oftentimes used by climate modelers, SSP 245 and SSP 585. And so these two scenarios, you can think of the SSP 2 4.5 scenario as being a lower emissions increase scenario, and the other one being as a higher emissions increase scenario. And so based on pre-existing projections of both temperature as well as population at the county level, as well as population projections for race and gender, we tried to estimate what would be the excess number of deaths associated with extreme temperatures by the middle part of the century. And so these maps here show, this first map here shows the estimated county level deaths currently. And then the second map here, this is only for SSP2 4.5, or the lower emissions increase scenario. This is the projected number of deaths by county in the middle part of the 20th century, or sorry, the 21st century. And we can see that the number of counties with a high number of deaths is slowly creeping northward. And so here, in the numbers here, we can see that in the current period, we estimated that about 3,000 excess deaths per year occur due to extreme heat, and about 5,000 due to extreme cold. And so this is a well-described phenomenon that currently extreme cold is leading to more deaths than extreme heat, or is at least associated with more deaths. And so the total number was about 8,000. But when we look at the middle part of the century, we see that it's reversed. Now the number of excess deaths with extreme heat is much higher. It's about 15,000. This is up from 3,000, while the number of extreme cold-related deaths is lower at about 3,700. And so depending on which scenario you look at, the total number of extreme temperature-associated deaths is projected to more than double or triple in the United States by the middle part of the 21st century. And so then looking at some subgroups here, this is the percent change in mortality per capita. So this controls for changes in the population. We know some subgroups are projected to have a greater increase in the population compared to others. And we see that some of the greatest increases are seen amongst Hispanic adults, non-Hispanic Black adults, and here the reference group is non-Hispanic white adults. We also looked at metropolitan and non-metropolitan counties, and we see a greater increase in metropolitan counties. So moving on from cardiovascular deaths, a number of other studies have looked at other outcomes as well. And this is something that I found quite interesting is there's a growing number of studies that have tied ambient temperature and specifically extreme heat to mental health outcomes. And so this was a paper that was published in JAMA Psychiatry in 2022, which used data from Optum, which is a commercial insurance database for United patients, and looked at emergency department visits for mental health reasons. And they found that an increase in extreme heat days was associated with an 8% increase in the relative risk of emergency department visits for mental health disorders. And when they looked at specific causes, they saw an increase for virtually all different types of mental health disorders, including substance use disorders, anxiety, mood disorders, as well as self-harm. They didn't see as much of an increase for admissions or ED visits due to personality and behavior disorders. In subgroup analysis, they did find a greater increase amongst men compared to women. And we also found something similar in our studies looking at cardiovascular disease and all-cause mortality. And this could be related to pre-existing medical conditions. And we know that psychiatric disorders also vary between men and women, but also perhaps differences in exposure. Men are disproportionately represented in certain industries, such as construction and agriculture, where they might be exposed to a greater degree. And so thinking about why mental health might be tied to extreme heat, one theory is that this could be related to sleep disturbances. And so this is a paper from 2017 that looked at temperature anomalies. So this could be a change towards a more cold night versus a warmer night and sleep disturbances. And they found that temperature anomalies in the summer season were associated with an increased risk of sleep disturbance. And so this was likely due to warmer nights leading to people having more difficulty with their sleep, which is something I mentioned earlier. But interestingly, when they looked at subgroups, they found that this association was only really true for people making an annual household income under $50,000. So this suggests that either people who are lower income perhaps aren't able to access temperature-controlled environments quite as easily, or perhaps there's pre-existing medical, mental health, or sleep issues that are leading to these disturbances. And then when looking at 8 subgroups, they did see a greater increase in sleep disturbances amongst older compared to younger adults. So thinking about heat and vulnerable populations, so this is one of my favorite studies looking at the health impacts of extreme heat. And this was a New England Journal study that came out in 1995 that described the health impacts of the Chicago heat wave from that year. And so this was a logistic regression model that they ran, which shows up a little bit later in the paper. And what I want to highlight here is what are some of the factors associated with heat-related deaths. And so what they found was if an individual had a working air conditioner at home, or if they were able to go to some place with a working air conditioner, the odds of death were significantly lower. Similarly, if someone had access to transportation, the odds of death were significantly lower as well, while people who were confined to bed or living alone had significantly higher odds of dying from the heat wave. And so this shows that at an individual level, there are protective and deleterious factors when it comes to temperature exposure. So we saw that air conditioning access or use is protective. However, not everyone has the same level of access to air conditioning. And so this is a study from the Brookings Institute, which looked at US Census data between 2017 and 2019, and looked at air conditioning access across 5 different metropolitan areas. And fairly consistently, they found a greater disparity between white and non-white households, or individuals, I should say, and air conditioning access. And so a higher level of these bars indicates a greater difference between Black and white, or in this case, Hispanic and white, and the yellow is Asian and white. And we see across most metropolitan areas, the non-white subgroups have a lower access to air conditioning. And there's other studies also looking at things like building insulation, indoor temperatures, humidity, et cetera, of individuals living in minority neighborhoods compared to non-minority neighborhoods, and finding differences in that as well. And so another important factor impacting heat and its health impacts is the urban heat island effect. And so the urban heat island effect is when built up areas in cities get warmer than surrounding rural or non-built up areas. As the concrete and asphalt will absorb more heat, and so people living in those areas will have a higher experienced temperature than people living in less urban areas. And so one of the factors that impacts that is tree cover. What we see is that across the United States, this differs markedly. This differs markedly between neighborhoods and cities. So this was an analysis that was done by the New York Times. It was published in 2020, looking at redlined neighborhoods. And so for those who aren't familiar, redlining was an official US government policy from the 1930s, which identified neighborhoods that were the least desirable for investment. These typically tended to be Black majority neighborhoods. And even after the redlining policy was officially ended, these same neighborhoods have had decades of disinvestment and typically have a lower socioeconomic status. And so this is from Richmond, Virginia. And so we see the red line neighborhoods here, and the green here represents urban tree cover or tree canopy cover. And we see that these red line neighborhoods have lower tree cover than other neighborhoods. And these other neighborhoods are also historical neighborhoods that existed back in the 1930s as well. And so what's the consequence of this? This is the temperature experienced by people living in those areas. And we see those same areas have much higher temperatures than the surrounding areas. And so we can see that people, depending on where you live, there are substantial differences in the temperature that you might experience. And so this was another analysis that was published in Nature Communications in 2021, which tried to estimate the cumulative urban heat island effect intensity based on different subgroups. And they find here that for individuals of color, the mean surface urban heat island effect was much more intense compared to white individuals. And so pivoting a little bit from heat, I want to talk about a few other impacts of climate change. And so another important impact is air quality. So air quality and air pollution are major contributors to human health, and it's estimated that in 2019, approximately 4.2 million deaths globally occurred due to air pollution exposure. And so not all of this is obviously due to climate change. Climate change is having a very complicated impact on air pollution. Some air pollutants like ground level ozone and methane are greenhouse gases themselves. And then climate change itself is leading to an increase in certain pollutants like particulate matter and ground level ozone. And so just very quickly, particulate matter, it's complex mixtures of solids and aerosols of different types of chemical species. We usually classify this based on size. And so particles that are less than 10 microns are called PM10, less than 2.5 microns are PM2.5, and as a comparison, the human hair is 50 to 70 microns. And these smaller particles can reach deeper into the human body and get embedded into the alveoli and past the alveolar blood barrier. The sources of PM2.5 are pretty diverse. This can include natural sources such as wildfires, as well as man-made sources such as emissions from factories and vehicles. And then it is thought that perhaps organic PM2.5 or organic components of PM2.5 might contribute more to cardiovascular disease, while more inorganic components could impact the respiratory system. But this kind of research is still in its early phase. So why is PM2.5 increasing due to climate change? And so these are scenes we've all seen. This is from the 2020 California wildfire season, which was one of the worst in recorded history. Because of this, we've started seeing this effect. And so PM2.5 levels on average had been decreasing in the United States going back a few decades, but starting about the middle part of the last decades, researchers have started seeing an increase in PM2.5 levels. And so this was a paper that was published in Nature in 2023, which looked at PM2.5 concentrations across different regions in the United States. And they saw an especially sharp increase in this concentration in the more western area. So this is for the overall continental United States, but in the different regions, we see a sharp increase in the Northwest, the West, Southwest, and parts of the Rockies as well, and a little bit less so in other parts of the United States. Other pollutants that are also increasing are ground level ozone. And so ground level ozone, which is different from atmospheric ozone. So ground level ozone is formed when nitrogen oxides react with volatile organic compounds in sunlight. And so this increases with higher temperatures, increase in sunlight, as well as more wildfires. And so this is a projection from Europe, and we can see that by the middle part of the 21st century, ground level ozone is projected to increase substantially across most of Central Europe. And so there's been a number of studies that have tied air pollution overall with health outcomes. However, a few more recent studies have specifically tried to look at wildfire-related air pollution and how that impacts health outcomes. And so this was a study published in Lancet Planetary Health, where the researchers estimated that about 33,000 excess deaths occurred annually due to wildfire-related air pollution. Of these, about 7,000 were due to cardiovascular disease, and about 3,500 or so were due to respiratory disease. This is another study from California, which looks at a couple different types of emergency department visits, so cardiovascular, cerebrovascular, and respiratory. And for most of these, we see almost a dose-dependent response so this is the smoke density is the exposure here. So as smoke density increases, we see that the relative risk of all of these different types of ED visits goes up. And then they also looked at different subgroups, with older adults being in the blue here and younger adults being in the red. And we see, especially here for cardiovascular disease, as well as for respiratory disease, we see a substantially greater increase in the relative risk for older compared to younger adults. Sort of thinking back about certain populations. And so this is a look at redlined neighborhoods in 4 different cities: Philadelphia, Chicago, Detroit, and Los Angeles. And here, the study looked at nitrogen oxides and found that people living in redlined areas had a significantly higher exposure to this particular air pollutant. And so thinking a little bit about the sort of environmental justice aspect of it, which groups are responsible for the emissions and which groups are being impacted by these pollutants, we see that Black and Hispanic individuals are much more likely to be exposed to air pollutants, despite having a much lower emission level themselves. And so we can see this disproportionate impact on which households are perhaps responsible for these pollutants and which households are being exposed to them. And so these are a couple of studies looking at wildfire-related exposure. Specifically, the first study looks at county-level exposure to wildfire-related particulate matter by the social vulnerability index of the county. So a higher level of the index indicates greater social vulnerability. And so we see that these counties, on average, had a higher population-weighted exposure to wildfire smoke. And then this is another study that was published last year in PNAS, which looked at race and ethnicity subgroups. And this is for California specifically, and they found that on the x-axis here, I should say, are the years. And so across different years, they consistently saw that individuals who were identified as American Indian or Native American had substantially higher population-weighted exposure to wildfire smoke. So one other climate change related issue that is obviously quite prominent is flooding. And so flooding is also quite complex. Researchers will look at things like coastal flooding versus flooding due to hurricanes and tropical storms versus flooding in more inland areas. And so this all can vary, but this map here looks at coastal flooding across the US, comparing flooding in the 1950s to flooding in the 2014 to 2023 years. And so it's a little difficult to see, but what we can see is that across most coastal areas in the United States, particularly here in the Northeast, the rates of flooding in the current period are much higher than they were in the 1950s. And we can see that a little bit better here. And so here I highlighted the annual number of floods that are occurring here in the mid-Atlantic. And so this includes Atlantic City, Philadelphia, Sandy Hook. And so the bars here represent the annual number of flood events per year across different decades. And so we can see that compared to the 1950s, where here in New Jersey, there were only about 1 to 2 floods per year. Now, on average, in these communities, there are about 10 to 12 floods per year. And so this was an analysis done by the Federal Reserve Bank of Philadelphia, looking at our region and then trying to see what areas were impacted by flood risks more than others. And so this map here, which includes Pennsylvania, New Jersey, and Delaware, shows the pattern of the cumulative chance of flooding across these different regions. And so the darker shaded areas have a greater chance of flooding, and the lighter shaded areas have a lower chance of flooding. And then looking at this figure here, this was broken down into household based on income. So LMI stands for lower and middle income households, and MUI stands for middle and upper income households. And we see this interesting pattern that in more coastal areas, that upper income households are living in areas that have a high risk of flooding. And perhaps that shouldn't be surprising given the price of coastal real estate in New Jersey and Delaware. But when we look at non-coastal areas, lower income households have a greater exposure to a risk of flooding. And this was relatively consistent across the different states, but I would say it's most prominent in Delaware and New Jersey compared to Pennsylvania. So another city which also suffers from flooding is Chicago. And so this is the number of flood insurance claims from 2007 to 2016 by different neighborhoods in the city. And we can see here neighborhoods shaded in red are the ones that had the highest number of flood claims during this time period. And these neighborhoods also happen to be those which have the highest proportion of individuals identifying as non-white. And so we've also seen similar patterns for hurricane-related flooding. And so some of you might recall that after Hurricane Katrina in New Orleans or Hurricane Harvey in Houston, the neighborhoods that were the most impacted typically were the ones that had the highest proportion of non-white residents in those cities. And so the last topic that I'll quickly cover here is food security. So I'm particularly interested in food insecurity. We have some funding looking at the SNAP program. And food insecurity is obviously a socioeconomic issue, but increasingly we're finding that it's also an environmental issue. And so it's not surprising that crop yields are closely tied to the weather. And so here we can see corn yields in the United States between the 1960s and 2010. And we can see that probably because of technological advances in fertilizer, pesticide, genetics, there's been an increase in corn yields across the United States. But then we see these dips during this time period that correspond to various extreme weather events, whether they're droughts, floods, and then we see during this period between the mid-90s and the mid-2000s a more extended period of reduced yields, or that the rate of increase wasn't going up quite as fast. And so it's perhaps not surprising then that studies have suggested that climate change will lead to an increase in food prices. And so this was a study that was done by the USDA back in 2015 that looked at the projected food price level under different scenarios, different trade scenarios, and different emission scenarios. And I think this is obviously quite relevant given the current trade environment. And according to most scenarios, the food price levels were projected to increase. This is the percent change by the middle part of the 21st century. And these bars here represent food price increases or changes in a scenario with both high emissions and also restricted trade. And so we can see in those scenarios, prices might increase 20 to 30% compared to the baseline period. And so this figure here shows some of the different ways how climate change can impact food security, whether that's due to changes in crop yields. There's also some evidence that not only does it impact crop yields, but it also might impact the nutrition content of the crops themselves. And there's also some studies suggesting that dairy cows might be under a more increased heat stress, which can impact their output as well. So obviously there's a number of different ways in which climate change will impact food systems. In higher income countries like the United States, perhaps this might be tolerable, especially for a while, but this obviously is more of an issue in lower income countries where there's much higher levels of subsistence farming, where people are oftentimes growing just enough to get by. And so for those people, having one season of disrupted crops can oftentimes lead to famine, and we've seen that many times before. And so lastly here, I'll talk about how some people are maybe disproportionately impacted due to their occupation. And so this was a study done by the Kaiser Family Foundation. And here they looked at, or they identified some higher risk and lower risk occupations when it comes to climate-related health risks. And some of these occupations are perhaps a little bit more obvious. So people who are working in construction, people working in mining, people working in farming, they're obviously going to be more outdoors, but also people in indoor environments like kitchens that are also at an increased risk of heat exposure. And so then looking at the breakdown of this by race and ethnicity and other classifications, we see that based on where people work, individuals who identify as Black, Hispanic, or here this responds to Pacific Islander, have a significantly higher exposure to occupational risk compared to white adults who are the reference group here. And we see a similar higher increase for non-citizens, and then as well as a higher risk of exposure for people with less than high school level of education. And so previously I had shown that where people live impacts how they experience the climate, but here we can see that also where they work also impacts their experiences. So since we're running a little short on time, I'll talk about a couple of mitigation strategies. Obviously, a lot of what I've spoken about might sound a little bit doom and gloom, but there are some strategies that have been implemented that are being investigated. So cooling centers or heat action plans are something that are used increasingly by different municipalities, and these come in various shapes and sizes. Oftentimes, this will include opening up areas like libraries or other government-run areas for individuals who don't have access to cooling. However, the devil's in the details. How do you identify people who might be most at risk for this? They might not be the types of people who can themselves identify whether they need to be going to one of these centers. How do you transport individuals to these areas? What type of hours do you have, et cetera? And so there's a lot of variation in this, and I would say not too many studies examining the efficacy of this. Here in the United States, one of the biggest programs that perhaps is relevant is the LIHEAP program. So this is the Low-Income Home Energy Assistance Program, which is run by the federal government, although some of you might have heard that its future is also a little bit in doubt currently. And so this provides financial assistance to qualified individuals, typically folks who are making a household income less than 150% of the federal poverty limit. And so the LIHEAP program is administered by the state, so you see a lot of variation in who qualifies, what type of assistance they get, et cetera. And typically LIHEAP has been focused on heating. I spoke with a energy industry person a little while ago, told me that the biggest sort of supporters of this in Congress are cold weather Congress people. But increasingly, states are using LIHEAP funds for cooling as well. And so that's been done here in Philadelphia, Pennsylvania, as well as in New York. And some municipalities like Philadelphia have used LIHEAP funds to help people get access to air conditioning units. But oftentimes what happens is that it's a first come, first serve type of program. So once the annual fund ends, then people are cut off. So if you didn't get your air conditioning unit for that summer and the LIHEAP funds for your municipality are dry, then you might be out of luck. There's some public awareness campaigns as well that have tried to target neighborhoods that are disproportionately impacted by heat exposure. And this was a program, pilot program that was run through Penn and the city government here in Philadelphia. But actually, I want to talk a little bit about urban tree cover. So this is sometimes described as almost like a panacea, that, okay, if we just grow more trees, then perhaps this will improve climate-related health issues. And there is some evidence around that. And so there's a paper published in The Lancet in 2023, which was a modeling exercise to try and see how much would mean surface temperatures decrease and how would that impact heat-related deaths in Europe if the number of trees or the percentage of tree cover in a city was increased to 30%. And the researchers there estimated that if that was done, that heat-related premature deaths would reduce by about 1.5%. So there is some evidence suggesting that this could be efficacious. However, it depends on where you're planting, what type of tree you're planting, et cetera. And so that can be a bit more nuanced. And there potentially might be some beneficial impacts on air pollution levels as well, as trees can absorb ozone and they can at least be a barrier towards particulate matter, although they can maybe also increase pollen and other types of PM 2.5 levels as well. So once again, it's a little bit more nuanced. So I'm going to skip over this this slide here, and I'll end with this notion of planetary health. So this comes from a report that was published in the Lancet in 2015, which highlighted the interconnection between human health and the health of our planet. And so this relates to not only climate change, but also things like biodiversity and global pollution, et cetera. And hopefully I've highlighted this strong interconnection between the health of our planet and the health of our societies, as well as individual level health outcomes. And so in summary, climate change is leading to an increase in extreme weather events, including heat, increases in air pollution, flooding, as well as disruptions to the food supply and health systems. This impact, however, is uneven, where some individuals, some populations are being impacted disproportionately. And so mitigation efforts need to be focused on the individuals and populations most at risk for this. Thank you, and I'd be happy to take any questions.
Fantastic. Thank you so much, Dr. Khatana, for a wonderful, and insightful and inspiring talk about global change and the impact on our patients. Any questions or comments, please post them in the chat. I can lead off with a question that I had. So you showed some clear links between extreme heat and cardiovascular mortality. How should we as clinicians modify either our risk counseling or medication management during heat waves, and especially thinking about our most vulnerable populations?
Yeah, that's a good question, and that's a question I get asked probably the most, especially when I speak with like reporters and lay press. It's challenging because these are population level studies, and to say that a clinician should maybe change their medication prescription habits based on that is a bit difficult. But I will say that in my own clinic, for example, I'm seeing more and more that people will say that, in the summers, they're avoiding going out. They obviously, my patients all have cardiovascular disease. They're more likely to have symptoms like lightheadedness, shortness of breath when they're out in these really hot days. And so for those people, and all of my patients have pre-existing medical conditions that predispose them to this, I say that you need to avoid those really extreme, the outdoors or during those really extreme heat days, especially during the peak hot part of the day. So kind of around the 11 a.m. to 3 p.m. usually. That being said, now like I mentioned, we're seeing increases in hot nights as well, which probably will have an impact on our patients. I think for primary care providers, especially, I think they might be able to play a role in helping with avoiding utility shutoffs. And so sometimes people need doctor's notes for those types of things. People are looking into prescriptions for cooling. So can physicians provide prescriptions for air conditioning? And can that be used as a way to either subsidize or provide people with cooling? And I will say I have some colleagues here, some pharmacists here at Penn, who are investigating medications that potentially could be beneficial. And so perhaps not surprisingly, we're seeing that statins might have some sort of a role here. They obviously have an anti-inflammatory effect, and they do seem to play a role in people's health during heat exposure. And whether someone should be on diuretics or not, that can also impact it. So I will say the population that I think about is people with pre-existing cardiovascular disease and then people with occupational exposure. So if you have a patient who is going to be exposed to hot temperatures for extended periods of time, you might want to think about, okay, what is going to be the timing of the diuretic they take? Should we think about what are the best strategies, or at least maybe they need to talk with their supervisor about breaks that they can take throughout the day.
Wonderful. Thank you. We're about at the top of the hour. I don't know if anybody has any questions. It looks like there are a couple of questions in the chat. There's a few of them. Looks like Dr. Clark has a question. Dr. Clark, I don't know if you want to take yourself off mute and ask yourself.
Sorry, couldn't find it. Yeah, thanks for a nice talk. I think there are other questions there. My question really specifically similar to David's is, are there guidelines that are including climate change or extreme heat or physician statements that we can refer to, both for advocating for our patients and or for how we might advise them, in clinic?
Yeah, no, I think that's a good point. I would say I haven't seen any official position statements yet. I know some societies are working on this, so I would say stay tuned. But I would say that compared to when I was going to, say, cardiology conferences a couple of years ago, when there was absolutely no interest, maybe there was some interest in air pollution and its impact. I would say now increasingly across subspecialties, you're seeing a growing interest on the impact of climate change more broadly, ambient temperature more specifically. So I'll say that probably is in the pipeline.
Great. Dr. Khatana, I don't know if you can read we're at the top of the hour, but I don't know if you can read the questions in the talk. One's from Dr. Bates and the other's from Dr. Nagella. Naresh, you'll see it if you wanted to answer those briefly.
Yeah, so I mean, I'll mention for the federal grants, which is one of the, I'm not sure. We've had one individual who I don't personally work with, but a colleague of ours who had a grant terminated that was climate change related. So the federal climate funding climate is changing. That being said, I think there are topics like trying to understand what is the impact of temperature on human health that I think is going to be salient regardless. So I think some of this is like a framing issue. But yeah, no, this is something that's obviously an actively moving target. So this other question about sort of medical education, that's definitely an interesting point. I've given a couple seminars now to the medical students and our fellows about this, and I would say a lot of this is being driven like almost bottom up. So where this younger generation of students and residents are oftentimes more interested in this topic than perhaps faculty members. And I think responding to that, we're seeing a growing inclusion of climate-related topics in syllabi. Because I think regardless of whatever your political persuasion is, understanding the impact of environmental exposures on health is definitely an important issue.
Fantastic. Thank you so much for the talk, and I hope everybody has a wonderful day.
Thank you so much.
Thank you.